Only one bill, though, this time. Please, sit down, thank you. This has been a long day for some of you. No, not for me. It's a pleasure for me to do it. But for some of you, and it's taken a lot longer. I know here, some of you are here much longer than you anticipated from the time you were told, and the reason for it is pretty simple. We've taken lots of pictures, and there's been lots of discussion and lots of camaraderie and people meeting and greeting one another who have been working for a long time on a lot of issues. And so human beings being what they are, the time factor was seriously underestimated.
My bad.
Sorry.
Sorry.
No,
It's okay.
but it's a good thing. No, but everybody has a smile on their face because what it means is this was not pro forma on anybody's part. None of these bills today, including this one especially, is anybody going through the motions. It's quite the opposite. It's a lot of dedication and a lot of concentration, particularly for those that have a formal work effort associated with it, and for a lot of other people because of their interest. We're trying to transform healthcare. We have an imperfect instrument to do it. I dare say for most of the people in this room who have had an interest in this area for a long, long time, in my case, literally since the beginning of my political career. I mean, it's almost and before that, when I was at university teaching. So me, it's almost half a century of being frustrated that what I wanted to see take place wasn't happening, and taking fits and starts and baby steps and sometimes a little bit bigger step to try and come to grips with national health care. And my interest in it, believe it or not, goes all the way back to Harry Truman and what he attempted to do in the postmodern, post-World War II age of instituting national health care. The closest we have anything to it is the Veterans Administration and Medicare and Medicaid. And what we're trying to do with the Affordable Care Act is, short of moving towards what I believe is the inevitable step of national health care, is to come to grips at the state level as much as humanly possible with delivering a universal health care capacity, at least as far as each state is concerned. And we're, I believe, as a result of many of the people, of the work effort of everybody in this room and others whom you represent in this room, I think we're in the forefront across the country in addressing precisely those imperatives. And so the HB656, the Health Care Administrative Uniformity, it's a rather dull distinction. In fact, it's a little bit intimidating, I suppose. We want administrative uniformity. I can hear echoes of George Orwell in it. You know, what's that about? Administrative uniformity. Oh, can I join? You know, right? That's something I want to devote my life to. Can I put all my efforts behind it? You know. So, but what it does mean, though, for healthcare, however, is almost the exact opposite. That is to say, it's opening up the possibilities of healthcare delivery. That's really what we're talking about. This uniformity is not something to constrict anybody. It's to actually open up the possibilities for the delivery of healthcare on a reasonable and rational basis in a way that takes into context the human condition, the human dimension of all of this. And that's, I think, the singular thing associated with this program. We've tried to put the human being at the center, the individual customer, consumer of healthcare, the one who is totally dependent on the capacity of the state as an administrative unit, as an instrument of our will, of our political will, the capacity of the state to deliver. That's the whole point. This is something that, in terms of the garden variety exposition these days of what constitutes political ideology. Is this conservative? Is it a liberal? Is it a radical? These terms are so inadequate and have been so debased and abused by virtue of pop media and pop cultural references and contextualization of what otherwise is our serious philosophical foundations as to how we think, what we think about who we are and where we're going and how we get there. All of that's been debased and turned into a contest of wills, a kind of a philosophical tennis match where we're reduced to being spectators with our heads on a swivel, watching the ball of negativity go back and forth over a net which has become an obstacle and a barrier to the delivery of health care rather than a bridge to it. And so everybody in this room is trying to subsume all of that negativity and put this on a positive path, and that's what this bill does. I'm very pleased the legislators are here, some of whom have been here most of the afternoon, because they have spent most of mornings and afternoons in the legislative session associating themselves with fundamental legislation that has real meaning and everyday meaning in everybody's life. So this establishes a healthcare transformation program within the governor's office. It only makes sense to do that because we're in a pioneer phase here, and we have to have the flexibility to be able to go in different directions, sometimes on the same day, and you have to have the executive hammer behind it. Let's face it. The legislature meets and sets the direction, but the legislature is in no position for the everyday administration and the uniformity of administration and effort. That is the duty constitutionally of the governor to pursue, whoever the governor is. And so what we're trying to set up so it's not dependent on an individual. You can't institutionalize a mood. But there's any fundamental rule of politics I've learned is you can't institutionalize a mood. That's why this Occupy stuff has fallen on it so coldly, because that's a mood. That's a passing ephemeral fashion that has no substance and nothing solid behind it. It melts into the air. What you have to have is an executive that establishes an institutional foundation that is going to transcend any individual. And that's what we're attempting to do here. What you do have to have is an executive that's going to get behind this and not let go. And for whatever, everybody's virtue is their vice. I understand that. But one of my virtues is energy and relentlessness. Now that gets me, as I say, it's also your vice, and I understand that. But I know everybody in this room is forgiving. So, and there wasn't quite the response. But that's what it's going to take. And that's why it's it should be in the governor's office. It identifies the issues needed to be addressed to achieve statewide healthcare transformation. Especially important in this state because everything tends to be done on Oahu. Part of that is just logistical. The overwhelming majority of the population is on Oahu. And most of it is concentrated on this side, on the leeward side of Oahu. So it is not just a nod in the direction of political correctness to talk about statewide. Statewide has real implications in Hawaii and requires serious effort on the part of those in charge to make sure that they don't slip into a geographic hole and not necessarily forget about, but fail to provide adequately for the entire state to be included in practical terms and as the logistics of healthcare provision unfold. So it authorizes the governor to collaborate with stakeholders and subject matter experts to plan, develop strategies, the framework, et cetera, and a timeline for proposed legislation and rules directed at transformation. We've just been doing this with the green infrastructure. I started out the day with the green infrastructure bill. It took the legislature and I don't know, 27 groups, I think, at last count. 28 groups formally, plus a whole lot of other opinion that's out there. I mean, one thing you learn in the legislature and the governor's office is everybody's smarter than you. And they're quite willing to let you know about it. And then walk away, by the way, having delivered revealed wisdom to you. They then walk away so that you can then implement it as you will. And so this timeline and this transformation dialogue and conversation is important to put together because we have some national timelines that we're going to deal with. So it enables us to work together, I think, in the public and the private sector. Was that?
He's got a bird in his pocket.
Yeah, okay. There we are. There's no end to the ways we communicate. I do want to say, by the way, that I know there's been a bit of controversy, at least there was in the beginning. It's been much subdued now, I think, as a result, about putting private and public together. I am simply not going to make that division, not in this state. We're going to have the private sector, we're going to have the public sector, we're going to have the nonprofit sector, we're going to have just community spokespeople, particular interests within the nonprofit community, whether it's senior centers, whether it's advocacy groups for particular mental health challenges, diseases, gerontological and geriatric causes, and so on. Everybody's included, and because I want everybody inside. I don't want somebody on the outside who's waiting for it to get done so they can take shots at it. I want everybody in, so no matter what happens, you can't say that you didn't have your shot at it. You may not win, you may not succeed, you may not convince everybody else, but it won't be for lack of opportunity to do so. And so that's very, very important to me. Now, Beth Giesting and her team are working collaboratively, I believe, not only with state agencies, but everybody else. And if they're not, again, it's not for lack of effort. I'll tell you this, too, so it's clear to everybody. If you're not involved, it's your own fault. I don't want to hear from anybody, let's go on the record. I don't want to hear from anybody down the line. Well, gee, we weren't included. This is not the rail, right? I mean, every time for whatever you think about the rail, one thing I couldn't bear is somebody saying, well, gee, we didn't know anything about it. Hello, where have you been for 40 years? I got involved with the rail when I was when before there was an H1, when you had the 3M Community Association, Manoa, Makiki, and Moiliili, right? Because we were all connected. Then the H1 came rolling through, and split it in half. That's how long we've been dealing with rail. And have somebody come up and say, well, Jesus, I wasn't consulted. The same thing here. If you're not involved right now in healthcare transformation or something, well, that means to me you just got your head in the sand. That's all. There's something wrong with you. And so, Beth, you got that? You just don't.
These people have got their heads out of this.
You folks all have, but believe me, as this thing moves along, you're going to have somebody coming up and telling you, yeah, well, we weren't consulted, that kind of thing. No, that's we're doing everything humanly possible to see that that's out there.